Hello, tubaniriza ku Zubair TV. Thank you for joining us. This is a call for health and I am Diana Elizabethian. I'm here in Mukono, Chikoza, orthopedist and emergency care specialist. He's called Dr. Muwaga Hannington. Doctor, tusanyusa okusanga.
Nange nsanyusa okubalaba.
Niye, nja kusaba weyanjulireko abalabi baffe amannya go.
Yes, good morning, colleagues. It is a morning. My name is Muwaga Hannington. I'm an orthopedic officer, as well as I'm specialized in emergency care practice. I work with Mukono Access Clinic. That's where I work.
Okay, thank you so much. So, we kindly request you to like, share, comment as usual. So today tugenda kubanga twogerako ku bulwadde bwe bayita ettalo. Abasinga tukimanyi nga ettalo, naye mu luzungu omusawo yangambye bakiyita osteomyelitis. Bwe bulwadde obutera okwata abantu ng'oba katugeze nti wafunako accident n'ogenda n'ofuna obujjanjabi oba oluusi obujjanjabi tebumala nnyo, ogenda kulaba ng'ozzeemu okuzimba omukono oba ekigere. Yeah, so musawo.
Yes, thank you so much, Madam Elizabeth, for this opportunity to have a discussion with you as pertaining this topic you have given to me. So much humbled, and I wish all our listeners and viewers shall enjoy the program. So I've been tasked to discuss about osteomyelitis, or more so people call it ettalo.
Yeah.
Osteomyelitis. So basically osteomyelitis, it is an infection of the bone. As we hear the word osteo is the bone, and the bone getting framed depending on the nature of the infection it has gotten. So mubumpimpi, osteomyelitis or ettalo, it is an infection, whether bacterial, fungal, which affects the bone.
Oh. So
osteomyelitis, it cuts across whether you're a male or a female. You can also be part of that. You can be a candidate of that infection.
Oh.
So, as I've said, that infection, it cuts across all sex, whether male or female, but it categorized can be in some age group. So between the age of 12 years to 35 years, stretching to 40 years, there can be a chance or candidate of osteomyelitis.
How about 50 or 45 plus?
50 years, it can be also, but we look at the category which are more prone to this infection.
Yeah.
But I've not said that a person of 90 years may not get the infection. So depending how and the nature of injury somebody has gotten in the past, but all of us, we are candidate of that disease or infection.
Okay.
So somebody can ask him or herself, what is the cause, the basic cause of this infection?
Ettalo.
Because abamu bagamba ettalo bandoze.
Yeah.
Abamu n'agamba ettalo bali nsindikidde, nabadde mbuuka akati. I was jumping something, then something small, it pricked me.
Yeah.
This is how I have ended up having this. And I had the misunderstanding with my relative, and from the blue, this is where I've ended. But basically, the major causes of osteomyelitis, it is not tradition, neither it is not culture. That the causes are not culture. So we need to look at it in a broader perspective, because the first cause of osteomyelitis, it is when you've had a post-surgery, you've had a surgery.
Before. Maybe, yeah.
You've been operated, maybe a cesarean section, you've done a laparotomy, you've ever had a bone surgery, you have put an implant in you, bakutademu ekyuma.
Oba nti katugeze nti maybe omenye so
So oyinza okuba omenyese ne bakulongoosa ne bakuteekamu ekyuma. So maybe in the course of like 5 years n'ofuna infection eyo nga wagipikinga in the course of the operation. So that is one, operations, surgeries, other cause. Then also another cause of an infection, it is an infection adjacent to the bone. This is where I mean that if you have a chronic wound or in a bweri olukonvo banga teliwona nga lirwadde, so bacteria esobola okuba nga etransiatinga oba emovinga negenda ne affecting egumba.
Okay.
So amabwa agatawona also can be
a cause of
ettalo. Then ekirala kiwandibadde otunulyako obwanga kikozinga accident, kyekintu kiwandiise accidents. Wetufunira accidents tetumanya owawa ogudde wafaanana watya, but if you're born, if you happen to get an open fracture nerikoona mu ttaka.
Musawo nja kusaba onyonyoleka omulabi waffe open fracture egumba erinenyese.
An open fracture, more so people call it a compound fracture. It's whereby somebody, the bone, you break your bone, it communicates with the environment. That is an open fracture. So if this bone gets to the environment, then it gets back, you don't know what it has picked from the external environment, it goes inside, then that bacteria can harbor.
Okay.
So your skin can harbor it, nebeera we infection energy keeping her for some good years, 5 years, 10 years. The infection is there because you look healthy. You keep it.
You see, okay, they treated me, I'm fine.
You're fine.
Yeah.
But when that time comes, when your immunity gets low, that thing has to show up. So accidents can be a cause of osteomyelitis or
ettalo. Yeah. So, doctor, how about this thing? I've watched this in society, by the way. Most times, those patients who have gotten fractures, they have a tendency of going to herbalists. I hear them, there is this a term they use into okuyunga. Yeah, okuyunga magumba. So I brought this because there is a lady I heard from. She had this problem. Kati we again they were herbalist. Ne bamuyunga bulungi. Then after some time, nera napikinga. Naddamu okufuna obulumi. Awa wali wamenyese.
Kakati, what happened is this. If you get this person you're referring to, whom you're letting as an example, it can be omuntu ono bw'ofuna injury accident. N'ogenda mu herbal. When you go to the herbal, the person who is working on you, I'm assuming that you have not picked a bacteria. This is bacterial Staphylococcus aureus, which causes osteomyelitis. That is this. Akawuka akakozinga osteomyelitis tukayita Staphylococcus aureus.
Okay.
So you can pick it anywhere.
Oh.
Kati gwe bw'ogenda mu bantu bannaffe bano abayunze, most cases they don't put on gloves. Sure. The environment where they are working from is not conform to the standards which can make you safe. So sure. Somebody keeps on putting drugs on your wound. At the end of the day, you're going to pick that infection. So that's why you see that in most cases, after some time, somebody has healed, that thing shows up. What God did not make in your body, it will show up one time, at a time X, of which we don't know which time is that. Sure. So that person, I'm putting in a quote. I'm not saying that he got the bacteria from the herbalist or the traditional bone setter, or he got it from where he got an accident from. But he had it and he was moving with it. Maybe he made it worse. When he went there, somebody just used the herbals using his hands, not washed.
Yeah, of course.
He has touched into his nose.
Yeah.
Nakutabulira eddagala nakusiiga ku kiwundu nakusiibula Katonda nakuyamba n'owonerayo.
Nasibako banana fibers.
Nasibako banana fibers.
And you're okay. And if you tell somebody, I think it is wise to visit.
Do you know why? Do you know why people sometimes they register success? They register that they say I went to the traditional bone setters and it's very okay. I'm moving very well. The healing is very fast. But the fact is, healing a bone, if it is a natural cause, it will be natural.
Oh,
if you're to heal 6 weeks, it will be 6 weeks. So, being there is not going to change anything. But however, it may even delay because somebody is tampering with your healing process. So, that's why in most cases, relating to what you've said, omuntu asobola kufuna infection yadde nti ne muddwaliro esobola okugamba nti banyonze mu ddwaliro naye ate enfuniddeyo infection. Ask yourself, what was the nature of the accident?
Oh, yeah.
However much we have done much to debribe, clean, and how sure that you didn't have that bacteria in your body before you got an accident? This accident was just a sparkling factor to trigger that infection to wake up. So we need to be so vigilant. Basically, those are the basic things in which how you've been kuyunga di. I don't know if it is proper English. How you've been.
That's what they say, of course, like okuyunga.
That's how.
Our herbalists.
Herbalists.
However, we are not critiquing.
I'm not. Hey, let me put it clear. I'm not criticizing it because we have grown up seeing them. But these are the people which cannot deter them from their system because our community believes in them. But the fact is, how are you doing it? Who is doing it? Do you have the knowledge?
True.
We have seen people get into more complications even worse from there, and even in the hospitals. So the issue is, when they don't know how to do it, you better consult other than let the person losing their leg, as we shall look at the complications of the stomatitis. So I'm not criticizing because I'm not criticizing herbalists either.
So doctor, ngenda kusaba otunulemu eyo kamera oddemu omenyera omulabi waffe ebireeta ettalo. Okusooka, you mentioned about posts. Is it?
Ngenda labyogera mu Luganda.
Thank you.
Ebisinga oleeta ettalo mu Uganda oba mu Africa, that is one. Omuntu nga bamulongoosezza. Si nti gwe balongoosa yena agenda afuna obuzibu bwa stomatitis. But how the surgery and where it was conducted can be a cause. Because the infection esobola okutambula n'egenda. Another thing, the accidents. Omuntu asobola okufuna accident w'ofunye akabenje n'opiikinga akawuka ako n'ogenda nako. Ekyokusatu, ng'omuntu oyo ekyokusatu kyandibadde nti ebbwa, ng'ofunye ebbwa ery'olukonvu oba eritawona. Akawuka akabeera ku bbwa kasobola okusala ne kalumba eggumba. So teri ddogo nti bakuloze. Esi kozi nti ettalo baliko bandoze wiiki
There is nothing like that.
It is not.
Oh my God.
There are those who, as we shall have our discussion, bakubamu empiso that they will die. In my 10 years of working, I've not seen anybody die in my hands. I've been injecting them and treating them.
Those people with
So I've not seen somebody dying. So that is a myth that they will be injected and they will die. I hope you understand the word myth.
Yeah, I understand.
So the word myth, a theory and a hypothesis.
Omulabi waffe ali eyo musawo aba yeetaaga okumanya nti kino ekintu tugambe nti oba twakula twakisangawo ng'abantu webatyo webakola ki webakyogera nti like endowooza yaabwe bwekyo bweri.
Yes. Tetujja things are keeping on changing. Things are keeping on changing. My dad had a small phone with an Elio. Now he's having nowadays holding an iPhone. Even his son, I'm not holding an iPhone.
I know.
So, we need to understand that things really change.
True.
If you happen to see that there are some symptoms you can look, let us make use of the facilities. Make use of the consultations. I don't know how much it costs you to move to the hospital to consult before things go out of your hands. There are some causes you can look that I think I need to see a doctor. Because these things, osteomyelitis, it has stages. Just like 3 stages. Somebody can look at that and say, oh, because most cases when you ask this patient who has ettalo or osteomyelitis, wherever they call it, where you're coming from, they have steps they always tell you. Musawo, na ino omusujja ogwakawungezi ne kumacha ogwo ne gunnuma. Musawo, omutwe ne gunnuma, okugulu kuno okulaba ne kusimba n'ensigako emmumbwa ne kutowolokoka. Kati nze mpulira nga ayagala osesema, ogulu bwe nasiga emmumbwa n'emirayo kampiikulo okusaamu okusiiru natereera. Sawo ne kubeerawo ne mala emyezi 6. Those are the first signs.
Okay, so musawo tukyali ne Dr. Muwaga Hannington, musawo w'amagumba, mukugu mu kujanjaba amagumba. Katugendeko mu Bulango and we will be right back.
Bweyansanga nga nkola. First sight. I think I like you.
Kogwe.
Really?
Koye.
You're so sweet.
Mama bugambo nga bwali walusa.
Muntu wa luzungu nnyo.
Oyo nga namuwona
yakimanyi. Osobola okubeera ng'okimanyi eki kati omwami wange takola ku Sande. Muweeyo ka evening live band.
Wanje?
Mukubire ka video call awo. Mutwaleko out ku simu. Muwe ka session ka live band. Byekole. Munjuyo. Tinkuuka.
Kuba tinkuukira wogenda kwetinkuukira. Bano bamwe tinkuukira abatali bammwe era si bammwe wetinkuukira.
Naye oba omanyi okuyimba oba tomanyi kuyimba gwe mutwaleko out.
Mugambe mukwano olwaleero Sande beera nga weetegese ku ssaawa emu oba 10 nkutwala out essimu ekubeere kumpi nti
akubuze out ki
tigwe girinde beera n'essimu yo
teeka wali.
Zubair TV, Ensibuko y'amagezi.
Welcome back from that short breather. This is Zubair TV, a call for health. I'm still with Dr. Hannington Muwaga. He's a specialist of emergency care and he is also an orthopedist. Twogeddeko ku ebireeta ettalo. Kati tukomyewo musawo. Oyogedde about the causes of osteomyelitis. So by the way, you mentioned that people who are most likely to acquire this complication batandikira mu myaka 12 up to around 40 years. So you mentioned this, mostly it was about adults. Kati njagala okubuuza bano abaana abato, how does it come for them to acquire this complication? Mostly nti katugeze tamenyese, tafunye fracture. Can there be that possibility?
Yes, ekyo kisobokera ddala. Nga bwe nayogedde masooka nti ekyakawuka kano tekalina Luganda, bakayita Staphylococcus aureus. I don't know whether kalina ekyoluganda.
Erinnya era litiisa.
So omwana wazaaliddwa nga bamuzaala wano asobola okalonderawo.
During birth?
During birth.
Oh my God.
That is a surgical procedure. Nga bwe nayogedde nti ku causes oba ebisinga bireeta operation, a surgical procedure.
Musawo, atya? Because for us we know when it comes to medical, a patient will tell you, bwemba ngenze in a medical field mu basawo, the specialist, it can't happen.
It can't happen. But tugambye ku bantu abakola ki abayunga ne twerabira waliyo bannaffe ba birth attendants bamulerwa. So ayi byonna fine osobola okugamba nti chances z'okuba nga okafunidde mu ddwaliro ziri more less n'obutafunika naye ogenda n'obuuza omuntu bw'aba afunye kubanga bw'oba akawuka togenda kugamba nti olina test maybe gy'ogenda olwaninga bwete in the first phases but obuuza omukyala wazaalibwa wa musawo nazaalira awaka nenzija mu ddwaliro olaba ebintu ebyo musawo bansiibula bulungi mu ddwaliro ekkundi lino ne litana. Those are the things because bakusiibudde bakolako bulungi but how you live bw'obeeramu awaka nobody knows.
That is still an adult, but now we get. So when we come to the baby,
that is how he gets it. Because he's exposed to the environment. Tetumanyi environment buka kibulimu. Ekitegeera bwatu bwafuna.
Kati wabanga afunye that virus webange muyingidde, how does it come to display like physically? Netumanya oba wajja gy'oli n'ogamba maybe yakifuna bwati ne bwati.
In most cases mu baana abato it is very rare. Era ojja musanga maybe after like 5 years. But if it happens to be nti kiri acute oba acute bakyogera ate nga kyakatandikawe waliwo obubonero era olwenda olaba nti ewettala eryo ebiseera ebisinga owettala abasinga magumba mawanvu those long bones kisambi kugulu wano na wano gwe weebuze lwaki terikwata lubuto bwe libanga ddala baaliro lwaki taloga ku lubuto. So in most cases bacteria etambula nenoonya amagumba amwali obusomyo eggumba erimu obusomyo nekatuula netuula mu bone marrow netuula mu myaka nga 10 nga tenyega okitegeera your health olya bulungi until that time x gyotamanyi nofunawo kikoofu waoli n'agenda ku scratching nakutakula akati okutakula akati ogenda olaba omukono guzimbye musujja anything pricks you. Most cases omulwadde ajja kugamba gwe bw'obuuza yettala agenda kugamba awantu wano watandise kwokyerera akatutu kano ne kajja akatutu ako nemirayo ampiclox zange ate bwamira ampiclox most cases asobola n'omala emyezi ena nga tazeemuddira because yeddagala erijjanjaba oba amoxicillin. So obubonero bulaga nti omusujja n'okuzimba n'olaba olususu nga lwengeredde n'akatutututu ebyo mu stage esooka emyezi 3 omusujja bagujjanjaba leero enkya n'ofuna omusujja omulala kitegeera. So bubonero obusookerwako n'okulumwa okugulu mukama bakuyamba ne bakujjanjaba n'owona egyo emyezi 3 bw'oba tofunye n'ogenda mu bintu bino bakutaddeko habo ekintu ekijja kudda mu stage endala gye wandiise kati kifuuse chronic kiri serious. Eggumba jjukira tugambye nti liri mu busomyo infection eyo eri mu busomyo likola amasira gaagala fuluma tegalina egafulumira. So olaba era awantu awo waba wabise ajja kugamba lyabise naye likoze oluseke liyiwa gye twandiise sinasi oluseke luyiwa amasira awo asobola obeerawo naye bwa okumala emyaka 5 oba 10 nga is very okay. So the last stage aba atambula n'amenyeka kitegedde. So beba abantu bagamba nti musawo mbadde mbuka eddaala n'emmenyese
kataawo. If you come to our African culture wajja okugamba akyayika nabuusa ekintu
kalibe kamutakula kagamba ate mbadde nina enkaayana n'ettaka negundi atandika obigatta nabadde ne mukagundi naye you know a person who is a sinner ng'alina ekibi kye ng'alina ebibi bye ajja kubyogera wano agayina ekyamazima kano akantu keerese naye bino birimu African chemistry
Yeah.
Alimu African chemistry. Ate nga buyazze bubi. Woba ng'olina akawuka ko ofuna n'ebyo ebintu nga wagenze n'okola ebitaliyo ne bijjira awo.
Oh, I see.
So, leka tube so oba twetegereza obubonero obwo obusooka bw'oba ofunye ebbwa eritawona okumala omwezi myezi
obubonero musawo.
obubonero obwo ebbwa eritawona alaba omusawo toteekako eddagala okitegeera toli nsolo oba n'ensolo efuna obujjanjabi. So let us respect life.
True.
You have one life and you live once. So bw'olaba ebbwa eryo olaba okugulu entumbu eyo etuuka eseera n'efuuka red n'ebuguma olina akalutulututu. Don't talk about that the boyfriend has sent Juju. Go to the facility.
Sure.
Yeah. They will guide you.
Yeah. So musawo njagala kuzaamu ku mabega. You mentioned nti a virus etanya okwata abantu abalina longer bones. Is it applying to tall people or even a short person can be having short bones?
Everybody has long bones.
Really?
This is a long bone. This is a long bone. The femur. Those ebintegeza kutegeza nti amagumba amawanvu. This is not a long bone.
Okay.
This is a short bone.
I get the point.
Kyembadde ntegeeza. However, nti infection esobola okujja wano. But in most cases, eyagala omuli obusomyo where it can hide and feel safe.
Okay.
Yeah.
So
because naye benoonya survive.
Oh, I understand. So we've talked about all this. Kati omuntu oyo bw'ajja gy'oli, how do you treat and manage this complication of osteomyelitis?
There are 2 or 3 ways of treating that person. Esooka ddagala ate ery'ekizungu si ery'ekinnansi. Aye tobitabula. Olina omira eddagala akwandikire musawo wandiika eddagala limire nga bw'oteerabira kulya. You take it. That is one. Doctor akulabe akuwandikira eddagala empeke. Another thing, musawo akujjanjaba agenza akuwa ampiclox ekintu kyabisse.
Ampiclox?
I'm giving an example nikwadde ampiclox.
Okay.
Nyinza omukuwa nnaku 3 ekintu ekyengera.
Yeah.
Awo nze ngamba Mukama yeebazibwe.
Really?
Kubanga kyabisse. So the next thing, we make a small incision tunyiga ebikyafu gwandisa pass oba amasira gaveemu bakuteekeko oba lyampisa oba mpeke depending omusawo alabye atya. Okumala ebbanga lyalaba nti ojja kukola ki? Awo bwe kiba kikaze wakyanseera okuleeta olusirasira olujja otonotono nga terubona, ajja kugamba tugende tukuba ekifaananyi.
Scan. Yeah,
I don't know whether you're meaning X-ray, but I said ekifaananyi. Scan ewene endala.
Oh really? Yeah. Enebeera X-ray.
X-ray.
Okulaba eri munda.
Okulaba eggumba liyitya. So akuba X-ray balabe. Then obasa ekyo bakulongoose. Ekisembayo mu bujjanjabi okugulu bakutemeko akawuka kaleme kweyongera kulya walala.
Musawo mulimu n'ebyokutema.
Okutema mwekoli oba okujjako.
Kati kijja nti does it apply to every patient with that complication oba nga wagambye nti when it's now chronic?
Omanye, do you know why abantu bano bajjako amagulu oba maybe okigonza kujjako kugulu? Omulwadde ono ajja mu ddwaliro ekyamazima najja yeka n'omuwa empeke. Bwaddayo awaka n'asanga community. Bwenno ogenda kufa. Ogenda kufa ate gulina muwulira akwogerako mu bukyalo. Kati musajja tunaaleka eddagala n'agenda asooka agenda akaataaso. How do they say it in Lubale? and the issue is nti agenda kumuba ekinnansi kati agasa ebintu bibiri abasinga boolaba nga agize bicomplicatinze aba bagezezaako okugenda eringa option gyasigaza ogulo kwakujjako watuukira mu ddwaliro abasinga bwatuukira mu ddwaliro nga kyamazima ogulu kugenda kusalibwako obusalibwa but it is think ekintu kino kijjanjabika nga kikyali mu stages eza wansi oba oyagala obone obulungi but it is treatable. Ettalo oba osteomyelitis oba cellulitis wona oli mu early stages nga wakabufuna
nga wakalaba ezo signs ez'otugambye ezo
weebuuze ku musawo
anti musawo abantu bagambe balina okwetanira eddwaliro. People don't like diagonizing, they don't like screening, they don't take that serious.
Let me put it clear. Bw'oba tofunye budde kwebuuza ojja funa obudde obulwala. If you don't get time to consult, you get time to fall sick. I think that is it is kituufu. So ky'otategedde ku mubiri gwo ddayo ogende w'omusawo omwebuuze omugambe kino kino nkole ntya. A good doctor, a good professional person ajagala, he will guide you. Even if you consult a nurse, ajja kugamanyi sisubya nurse nurse atamanyi nti this is osteomyelitis. You say the best person is not a gynecologist. But somebody is a orthopedic officer, orthopedic surgeon, whoever. Is not an optician. They will guide you. So, don't be there. We have many doctors. Uganda is blessed with beautiful people with brains. But people don't want.
I know.
They don't want.
Okay. So, I think byebyo musawo tuyize. So, omuntu afunye obwo obuzibu alina okwetanira eddwaliro agende eri omusawo omukugu, a medical doctor. Kati ngono dokita muwaga ye yasoma kujjanjaba magumba aba agategeera buli kyayogera amanyi kyayogera. So I think that is all. I have been with Dr. Muwaga Hannington. He's so outgoing, he's so funny, so knowledgeable. This is Zubair TV, a call for health. I'm Diana Elizabethian. Don't forget to like, subscribe, share and comment. Bye-bye.